Welcome to Summit University. Today our guest is Stephen Acuff. He's a best-selling author and lecturer on health and diet in Europe and the United States. Mr. Acuff specializes in the macrobiotic diet. He is an instructor at the Cushy Institutes in Massachusetts and a nutritional counselor at a medical clinic in Germany. He is also director of a macrobiotic center in Sweden. Mr. Acuff is here today to talk about Oriental Diagnosis.
This session today I would like to begin with the diagnosis of the face as a tool for evaluating the health of people. The face is especially interesting for us because, number one, we don't have to have the permission of other people to use it. We can walk around and look at everybody's faces, and we learn a lot because we can see all these faces. We can even stand somewhere like at, let's say, the entrance to a big department store in a big city and just watch people buzzing in and buzzing out and just look at the faces as they go by, and you learn a lot. Whereas if we're going to look closer, like say what condition of the shoulders, then we have to be able to come close enough to touch them. So we do use facial diagnosis a lot in what we do, which is evaluating health. But it's always important to confirm our conclusions through other means if possible. So we learn a lot by looking at faces, but then it's nice to be able to use the other diagnostic methods which we have, like how do the hands feel, the ankles, shoulders. Now, facial diagnosis begins with a general appraisal of the face. Is it more yang or more yin? In other words, yang, which is the contractive force, showing a lot of hardness in the face, or especially vertical lines. Like we see vertical lines in the area between the eyebrows, or we'll see vertical lines on the cheeks. Or we'll see someone who has lips that look like they're pursed, but they're actually not. No? Is there something wrong? Oh no, I'm very happy today. And it's because there's so much yang force in the body that it's pulling the lips inward. So when you look at them, you don't see much in the lips. Or we may see something that looks like more yin. Now, yin is the expansive force. And here, it will look like things are swollen, puffy. So that gives us a real quick clue. Does the face look more firm or even compact, or does it look like it's expanded? Now, this is just our first impression. And then, when we have that, then we'll look at some of the other aspects, like color. Look at the color of the face. Now, in the summer, when people are tanned, you have more difficulty getting just the right diagnosis of this. But after the sunny season is over, then you can see. Some people will have a color which we could call pale, a whitish color, which can indicate different things, like anemia, or it can show excess consumption of dairy food. People in Scandinavia, where I live, are considered to be pale people. And this is not only because there's, for half the year, very little sun, but also because of the excessive dairy consumption in those areas. The color can be reddish, like a reddish color, which shows an overconsumption of expansive yin foods, like sugar, strong spices like pepper. The red color we see is nothing more than an expansion of the blood vessels in the face, and the blood is actually coming closer to the surface. So it's a general expansion. So here we would be very careful with eating extreme yin foods and direct our food program, at least for the coming weeks, possibly months, to be a little more yang. In other words, the emphasis on root vegetables, grains, but especially being careful with fruit, even though fruit is in general a balanced form of yin. But if you've got a reddish face, you'd be careful of that. It can show a tendency to heart problems, expanded heart. Then we have also a yellowish tinge, which can have different causes. One is people who eat a lot of vegetables. Some people eat fairly good diets have a yellowish tinge, which comes from a lot of beta-carotene. Now, beta-carotene is in the yellow and orange vegetables, but interestingly enough, also in green vegetables. So if you eat a lot of kale and a lot of other green vegetables, you take in a lot of beta-carotene, which is good. Beta-carotene, we know, improves the immune system. It makes us healthier. It decreases the effects of free radical damage in the body, but it will make your skin a little yellow. Other forms of yellowish skin can have to do with liver problems. These are people who are not eating so many vegetables, but it's being created by a lot of very hard fats. And this, of course, is something we call more yang. It would be things like cheese and eggs, getting more hardness and showing especially liver. Some people will have, we could call it almost a dirty quality. The skin always looks unclean, like it needs a good cleaning. This would be more a problem directed towards kidneys. The kidneys are not handling their basic filtering function and are using the skin as a way of discharge. In Oriental medicine, the skin is sometimes referred to as the third kidney. It is the way the body has of discharging excess toxins, and especially when the kidney function is weak, it becomes more important that the skin can be used for this discharge. Sometimes people have almost a bluish color. It goes almost in the direction of purple, but more like bluish, which shows extreme blood stagnation. It's also extreme yin. So skin color can be either the whole face or just parts of the face. So we'll sometimes see reddishness only in the cheeks, maybe across the nose, but no place else. Or we might see the whole face red. Of course, the more serious condition is when the whole face is red. But even here, reddishness is showing that there is extreme yin. In other words, the sweets and alcohol and coffee and all these things that are from the extreme yin side. So that's something also we can have as our more, let's say, a general picture of people. And then we can begin to look a little closer at the face, which I have made a diagram of here. The upper part of the head basically has to do with the more abstract part of life. We could say the artistic, the intellectual, the spiritual. The lower part has to do more with the practical side of life. That's like the nuts and bolts, everyday activities. And the point is that we should have balance of both. We should have the ability to be spiritual on the one hand, but we should also be practical, because we can't really live the way we're intended to live if we get too much of one without the other. We have to make that everyday lifestyle function for us. So, the basic constitution of people, something they're born with and doesn't change, is that some people have a very high forehead. Their eyes tend to be further down in relation to the hair as opposed to other people. Other people are very much emphasized here in this area. Very much. When you look at the face, you see that the area from the bottom of the nose to the chin is what sticks out most, or what we notice most. So with these two opposites, we can get some insight into the person's basic constitution and into their, let's say, pattern for life. So people who have the eyes a bit lower, in other words, a higher forehead, these people are, say, more yin in their constitution. But, or while those who are bigger here, more yang in their constitution. So we would say that in general, for facial diagnosis, those who have very high forehead have an easy time going towards the artistic side of life, towards the intellectual and thinking part of life, towards the spiritual side of life. And those who are very much dominated by this area, they have an easier time dealing with the practical side of life, making everyday life function, being happy with their food, being happy with their families, enjoying their neighbors, that kind of thing. So what we should do in life is, if we see that we're very much dominated by this area, is we should really put a lot of energy into developing our spiritual side. In other words, meditative practices, chanting, things like that, which will raise our energy this is what we call yin energy. We're going up. Whereas people who have the very high forehead, we would say in general, should be sure to develop that practical side of themselves, making life function, because the two, of course, go very close together. There's no spiritual development in the real sense of the word without also having the physical vitality that goes with it. Like you can't pour that spiritual energy into a vessel which is not strong. So that's generally what we'd look at the face from the beginning. We would see constitutionally what's going on, but that's just something that goes very fast. And then conditionally, we look at is it fat? Is it compact? Are there vertical lines? Are there horizontal lines? The horizontal lines are showing, of course, the opposite, more yin. So, if we see a lot of lines in the forehead, this is showing yin. Now, I've got some of those, and many people have them. What happens sometimes is that we will have a condition which we then balance, but we kind of leave a mark of what we've been. Some people will have bags under their eyes, which are showing a disturbance in their kidney function, and they will balance their kidney function so that the bag will recede, and it'll now be a smooth face, but you'll still see that line where it was. So we distinguish between what is and what has been. So with lines across the forehead, it's really a problem with the lines across the forehead if it has the washboard look. You know, it's like this. Because this shows extreme yin. It's just puffing out, and this is a side view, of course. So the lines are the points where it kind of tightens, but then it's puffed out. Once a person has recovered his balance, there may still be these lines, but it now looks more like this. It becomes much less. So that's also for other parts of the body. So as we go into this more and more, we'll see that some people are showing signs of things which actually they have brought very much into balance through conscious living. Next point is looking at the eyebrows. Now, eyebrows, if we have thick eyebrows, this is more a sign of a stronger constitution. And thinner eyebrows, more a sign of a weaker constitution. So, as I mentioned in a previous session, because women will change the appearance of their eyebrows, we don't want to go in too much with women for eyebrow diagnosis, but with men, we can definitely do this. And what you'll see is people who eat a lot of animal food will gradually, over the years, experience that these eyebrows start getting shorter. So you'll see people that have just little tufts here and there. But if you see a picture of them 20, 30 years ago, you see that they have full eyebrows. So these people should be very careful about excess animal food consumption. And yang in general. Yang means contractive, too much salt, or too much hard-baked flour. Pizza dough and all of these things that people like. So, we look at the eyebrows, we can look at the nose, we can get an idea about constitution by looking at the nose. If a nose is longer, almost like you can see almost like a drooping look, this is a sign of a more yin constitution, and a short nose, more yang constitution. Now, of course, we're going to take into consideration here the different racial and ethnic groups. For instance, if you see people from India, you'll see many of them have that kind of nose. That's part of their racial background. So we wouldn't make absolute statements about all Indians being yin in their constitution, because that's part of their makeup. But in general, when you look at a lot of faces, you start getting a picture for what is yin and what is yang. A tighter nose shows that during the development of the embryo, there was a lot of yang energy, tight, compact energy, and the nose just didn't grow out so much. Whereas someone with the opposite, you'd see there was a lot of yin force there, and the nose grew bigger, and so much that it even has a slight downward tendency. So those are also more things we look at for the constitution. Then, with the mouth. Now, constitutionally, in other words, what you're born with, we'll see that the wider mouth is a sign of yin, the shorter mouth, or the tighter mouth, is a sign of yang. When you look at many people, you'll begin to see what is a wider mouth, what is a more tight mouth. So we talked about that in the session about constitutional diagnosis. The interesting thing here for our conditional diagnosis is that the size of the lips gives us insight into the condition of the digestive system. Digestive system is shown in the mouth area. So, Here again, we will take into consideration different racial characteristics because these affect it. But in general, when you look at people, you will see that bigger lips, lips that are more swollen, are a sign of yin condition in the intestines, and tighter lips, I already mentioned it once, are a sign of yang. Now, if you look at a picture of Pope John Paul, you'll see that he has very tight lips. His lips don't show much. When we look at a picture of him, we would first of all see immediately he has a very yang constitution. And he would have to have that after surviving the assassination attempt some years ago. He was able to bounce back. Strong constitution, but a little too yang. And it was interesting to read recently that he had an intestinal operation because intestinal polyps or tumors, and there's a thin line dividing them, unfortunately, are a sign of yang excess. And people who develop intestinal cancer tend to have the tighter lips rather than the expanded ones. So if you know people who have intestinal cancer, you should first of all strongly recommend that they immediately change their food because it has been proven beyond a doubt that intestinal cancer is caused by food, especially by meat and animal fat. A big study released about 2 years ago, a little less than 2 years ago, was published in the New England Journal of Medicine, gave very clear guidelines on what we should do to avoid that. So when we look at people, we can already see tendencies in this direction. And it's important because many people are getting out of balance. Well, I was in Singapore a couple years ago. I saw the statistics for intestinal cancer in Singapore. 1965 was not among the mentionable causes of death in Singapore. 1990, number 2 cause of death in Singapore. 25 years. What happened in those 25 years? Singapore went from being a poor, underdeveloped country to a rich, industrialized country which can afford all of the luxuries of modern society, which has a nice front side but a terrible back side. So we look at the face and we can already see tendencies to intestinal problems. Now, the lips will tend to contract a bit through macrobiotic practice on people who have already swollen condition. If we look at lips and see that they're expanded, it's good to take a picture of the face at this time, and then after some months, or maybe after a year, it doesn't come very fast, but it does come slowly, you'll see that the lips tighten up in many people, in any case. I was very surprised a few years ago when I was going through some of my old papers, and I found my student ID card and saw how I looked 20 years ago. I thought I should have looked better 20 years ago. It was 20 years less wear and tear, and I had the full advantage of youth. But I was surprised that it looked worse. When I thought about it, I could understand it. But what I especially noticed was that I had expanded, puffy lips. And they didn't look at all like the way my lips look today, because I was eating food which made my intestinal condition too yin. I was eating not a lot of sweets. I was one of the very fortunate to have come into this world as someone not addicted to sugar. But I still had enough other yin things going that I had a very expanded condition, and through several years of macrobiotic practice, my lips have changed. Now, the width of the mouth will never change. That's a constitutional factor. But what you will see change with time, and what shows you that the intestinal condition is getting balanced, is if the lips are expanded, that they begin to tighten up. Now, when we talk about expanded lips, afterwards, when you look at the participants here or any other people you look at in the next few days, you'll see that there is a big difference in lips. And expanded lips are a sign of extreme yin. And if we think of how the intestinal movement goes, it's like contractions and expansions. This is what moves the food through the intestinal tract. So we can also think of that in macrobiotic terms of being a yin or expansion phase and a contraction phase. Many people who suffer from constipation have too much expansion, and there's so much expansion through the wrong choices in food that they don't get that opposite, that contraction, and so things stop. Now, you can try different remedies for short-term relief, but to really do something about the problem, you need to change the condition of the intestines. And that means proper food, above all. That will regain that original yang or contractive force which the intestine should have. The intestines can also show disturbances by seeing discoloration. You'll see sometimes a bluish spots on the lips, which also show, as I said before, with skin color in general, the bluish color is usually a sign of, practically always a sign of blood stagnation. And if you see it on the lips in the form of spots, this is showing that the intestinal area definitely needs attention. Our great advantage with food therapy is that nothing reacts faster in a positive way to food changes than intestinal and stomach problems, because the food mass that you're putting in your body is being worked by these areas. When we talk about liver and kidneys, it becomes a more indirect thing, but very directly related to food are the intestines and the stomach, and these two have the most direct relationship to the quality of food you eat. So, we can see sometimes a lot of splits from up to down in the lips. These tend to show also problems in the digestive area, possibly the intestinal wall being damaged here and there. I don't know if you're aware of the fact that dairy food has a damaging effect on the intestinal wall. Studies have shown that some people with anemia have this because of the intestinal bleeding which is caused by the consumption of cheese, milk, and other products which taste delicious to many people but which in fact are far from healthy. And that through the intestinal bleeding, large amounts of iron are lost, and when these people stop their excess dairy consumption, their anemia disappears. I've had, I don't know how many women who have experienced this. So, hemorrhoids is another thing which can be shown by these splits. If the split is really deep, especially in the middle part, this split is showing yin. Now, a hemorrhoid is something which is expanded. It's too much expansion. To get rid of that, you've got to get rid of the cause and get it more contracted, or yang. So eating a lot of sweets, even if it's not sugar, can be honey or tropical fruits or just drinking a lot of fruit juice. If you go too far in that direction, it can create too much expansion, or if you've already got the problem, you may have to, for a certain amount of time, avoid anything that has more of this yin impulse until you've got more balance again in the condition before you go back to these other things like normal fruit that grown in this area would be a reasonable sweet quality if you're in health. But for hemorrhoid problem, I might recommend someone to stay away from fruit for some weeks because they need more of this contraction. So, intestines are divided into large and small. Now, the large intestine is especially shown in the lower part of the lower lip. And the small intestine is shown more in the upper part. So you'll sometimes see people who look like they're sticking the tip of their tongue out under their lip like this. So this is a sign of large intestine, and this is more yang. It's not really swollen, it's just like full. The more yin condition is if the lip protrudes out, more like just swelling up and sticking out. That would be more yin. Here, the lower lip, upper part. Sometimes the whole lip is very apparent. And you'll see when you start looking at lips, you'll see all kinds of variations. And some people you'll see have what I mentioned before with like, it looks like the point of the tongue. Other people will be very expanded in the upper part. And some people just like the whole lower lip looks very much out of balance. In fact, I have found one good technique for studying these things is because there's so much information here and so many things to look out for that you might, in the beginning, concentrate on certain parts of the body. Like as you're walking along and say, today is lip day. You know? So today we're just going to look at lips. So as you walk down the street of a town, you just look at lips. People walking by on the street, you know, that was yang and that was yin. And it helps you to focus because if you look at the nose and the eyes and everything at once, it can throw you off. So in the beginning, just try to concentrate on one thing. Say, I'm going to look at lips for a few hours. You might even dream of lips that evening when you go to bed. But it will then show you what is, first of all, a good medium. What is average? What is a sign of health? And then what varies from this average? Because if you haven't looked at lots of them, you don't really know what the average is. You'll notice that sometimes the lower lip is very expanded, whereas the upper lip is more normal or even somewhat small. The upper and lower lip should be about the same size. About the same size. That's what we could call the average. But they should not be big. Sometimes both are big. And sometimes the upper one is big and the lower one is small. If the upper one is more predominant here as being expanded, we would say this is a sign of stomach problems. Because the stomach and the upper part, also the esophagus, but especially the upper part of the digestive system is in trouble. So if both are expanded, then we would say that the entire digestive system is not in order, and there the absolute best help you can have is chewing your food. If you chew your food very well, you have already started the digestive process in the mouth, and you make the job in the intestines much easier. If you experience any kind of discomfort when you change over to this kind of food, the number one cause of that discomfort is chewing the food too little. We have to remember that the intestines are only the last stage of digestion is actually supposed to start in the mouth. Why do you think we have been blessed with all these wonderful teeth in this form? We have what are called molars. Molars are for grinding. And we are supposed to be grinding foods that need a lot of chewing. Now, if you eat a piece of cheese, you'll find that long chewing is not so interesting. As you chew it a little bit, then you swallow it. And if anyone is still eating meat, you'll find that especially meat, after about chewing a few times, you've just got this stuff in your mouth, and it's not particularly interesting. You swallow it and go on to the next one because it's the juice in the meat that really gives the taste. So, what you do when you change your food into grains and vegetables is you chew very well, because that will ensure that your intestines have less work. So anyone who has got that kind of swelling or too much tightness in the lips should think about chewing. And chewing doesn't mean 10 times or 20 times, but we recommend 50 times chewing for people with these kind of disturbances, intestinal disturbances. Now, it's not that difficult to do. I chew my food about 50 times just out of habit because I've been doing it so long. In the clinic where I work in Germany, where the patients are given 3 macrobiotic meals a day, we stress chewing and see that it does take time, that people will start out at 20 times and think they're doing great. And then they will break the sound barrier of 30 and graduate working on up towards they get up to 50, and then it just goes by itself. So it's not so difficult as it seems. It's not something you do from one day to the next, go up to 50. But in any case, we have enzymes in the saliva which start breaking down the complex carbohydrates already. And because people are used to eating a highly refined food which is lacking in fiber and not so high in complex carbohydrates, the chewing is really secondary. But when these people switch over now to whole grains and vegetables as their basic food, then the chewing becomes very important, because it's the digestive process of the mouth that starts. Then this will go to the stomach, and it will feel totally different in the stomach than it did before the good chewing. It goes on to the intestines. So chewing is something we should all think about, but especially those who have the disharmony in the lips, which is showing intestinal weakness. Now, the area at the corners of the mouth sometimes will give us some insight into the duodenal area. The duodenal area is a piece of the, actually an extension of the stomach. It's between the stomach and the intestines. It's the beginning of the stomach, the intestines, and it has a length of 12 fingers. And so in Swedish and in German, it's called the 12-finger intestines. This is where digestion starts. Now, this is also the area where the bile is coming out of the gallbladder, and if people are eating heavy, oily foods, then you can get problems here, and it will show with cracking in the mouth, at the corners of the mouth, or that sores form on the mouth. So the quick sores and cracks is to watch the excess fat, especially the kind you might get in a fast food restaurant. Like, you might think fish is great, so let's go to a fish fast food restaurant. But you would be getting an amount of fat and oil which would not be conducive to health. Then we have the area around the mouth. And this area corresponds to the sexual organs. So, we can see this, that a man has the ability to grow a beard, And that is an expression. This is the part of the face which expresses the sexuality, whereas the woman does not have this ability. If the man does not have the ability to grow a beard, or if the woman has a beard, these are signs of imbalance. Now, of course, a woman can't take away the hair, so it doesn't show. But for women who have this and know that they have a lot of hair on their face, it is a good idea to watch the young animal food. The male hormone level, we're all a mixture of male and female hormones. We're a mixture of yin and yang. The female is the yin, and the male is the yang. Everybody has both. But men have a predominance of male hormones, and women have a predominance of female hormones. But if a woman's hormone level goes up too much in the direction from male hormones, then she can get too much facial hair. So this is not only a cosmetic problem, but it is a reflection of what's going on in the sexual area. So if the quality of the skin in general is, let's say, not real clean, it doesn't look like it's proper, it doesn't look like the rest of the face, there's something different about the skin around the mouth and down to the chin, this will give us some insight into problems of the ovaries, uterus in women, prostate, testicles in men. The ovary area is shown especially in the corners of the mouth here. So sometimes women will get you'll see little pouches developing, pouches that develop here on each side. This is ovary area. Now here, of course, we're taking age into consideration. When women become very old, they may be developing this as part of just becoming old, that pouches develop. That's different. But if we have a 30 to 40-year-old woman who's developing these pouches, this is a sign that she should think about what she's doing that's bringing her out of balance, that the ovarian condition needs some attention. And especially around the chin, we have that which corresponds to the uterus. Now, what you'll see on the chin is maybe a reddish color. Sometimes it looks as if they've just rubbed here several times to make it a little reddish. It looks ruddy. So look at the face and see. If you see that the chin has a very clear reddish color as opposed to the rest, this can be a sign of going towards fibroid cysts. It's not good. You know what fibroid cysts are. The last stop for fibroid cysts is often removal of the uterus. Now, in the U.S., about 60% of all women over the age of 65 no longer have their uterus. It's a very common operation. They say, you don't want any more kids, what do you need that thing for? If you don't have any immediate use for it, let's get rid of it. Well, there's something to that. If a person is really going to make the wrong choices with food, then you may have to do that because you can get a lot of problems. But I have had countless women through the years who have been able to balance the condition, spare themselves the agony, the discomfort, and all the after effects of a uterine operation, removal of the uterus, by cutting down on the amount of animal food. Now, the inside lining of the uterus hardens when the woman eats excess protein. Now, protein is very often in animal food. So, this may cause, with the hardening, it may cause very chaotic menstruations. If the woman is bleeding a lot, she may hear from the doctor that she should eat more meat for the iron. It's a very common thing. Now, when she eats the meat, this will make her uterus harder, and it's like a vicious circle that she has difficulty getting out because the doctors have not understood all of the effects going on here, all of the ramifications of eating meat or high protein foods. So this is a very common problem in Western women and much less so in Eastern women. Oriental women have much less fibroid cysts, they have much less uterine cancer, and we have only to look at the kind of foods they eat to understand why. Much less animal quality food, much more vegetable quality food. That's the basic energy for female, is vegetable quality food. Of course, sometimes it's fine to have some animal quality food, but in our society, it's mostly 3 times a day, 21 times a week at least. They're taking animal food, and this is too much for female energy. And it can become more animal food than anything else. Go to a steakhouse and see what people are doing there. Go to fast food restaurants and see what people are ordering. So right here we can see it. And as the condition recovers, you'll see the color start changing. It'll become normal again. But sometimes it's not that dramatic. Sometimes it's just a slight discoloration here. Sometimes when cancer develops, you'll see kind of a grayish-green tone to the skin that develops especially around the mouth. So if the condition of the female area is especially young, then you may get some wrinkles around the mouth. It's almost like this. We got all these little lines around the mouth. This is a sign of too much yang. It can be too much baked food, salty, and animal quality food. Those are the yang impulses. So an elder woman may have this because when she stops menstruating, her female area does in fact become more yang, but that's all part of the life process. So these wrinkles around the mouth are not important for women beyond menopause, but they're especially important for women before that as a sign of imbalance. And this is very interesting because the health of our sexual organs is really a summation of our health. Like nature has determined that we should have children. That's really the purpose of why we're there, is to give birth to children, that the species continues. This is true for all animals. For deer and for elks and for cats and dogs, it's the reproduction, that there is a continuity to life. So let's imagine what happens when people lose their reproductive energy or they get problems in this area. It's a sign that the overall health is really deteriorating, because the result of good health is strong reproductive power. So we have to think about what we can do. Now, this isn't always easy. What I'm giving you here are the general guidelines for recovering health. But each person will also have special things to consider. There may be special situations. Some people really find their balance through trial and error, trying this and that, but always keeping the spirit of experimenting. So, with men, we can see prostate troubles developing, also if this develops, or also if prostate can also show as pouches developing on the sides here. Now, interesting for me has been through the years noticing how much uterine and prostate problems are connected to the liver. Now we see the liver by lines developing here between the eyebrows. Really like a really deep thing here, or sometimes two of them, or three. But this area looks tense, almost. It's like we're frowning. And we may be very relaxed, but we look that way, or in any case, you see the lines. Now, when these deep lines develop, you have a clear indication that the liver function is out of balance. And I find that when I look at people who have prostate cancer or inflammation of the prostate, which is like a pre-stage to prostate cancer, that so many of them, almost all of them, if not all, have got very clear signs of liver disturbance. And the same also with uterus, with women. And it's interesting to think about the flow of the liver meridian in acupuncture. It's a very interesting meridian. It starts on the big toe. It's on the side towards the second toe. It goes up the leg on both sides, and the left and right branches of the liver meridian meet in the uterus. It's actually quite a unique place where they actually come very close together. They meet in the prostate in men, and these two branches meet in the uterus of women. Now, energy disturbances are carried over the acupuncture meridians. That's why acupuncture works, because we put little needles into those acupuncture channels, those energy channels, and we get some very quick results of changing the person's health condition. Now we can imagine what would happen if the person is taking the foods which create stress in the liver and the need to discharge, that this imbalanced energy is flowing through the liver meridian, and at this point where these two touch, you have a very sensitive area. So for me, prostate and uterine problems are not actually the real problem. And here's where we get into more holistic thinking. We're trying to look beyond the symptoms. We're trying to look beyond diagnosis of symptoms and try to find out what is the real cause of this problem. It's a little bit like playing Sherlock Holmes. You know, my dear Watson, you know, we think about how can we figure out what is the culprit here. You know, aha, it's the liver, you know, it's the butler. Because the uterus was only the place where this imbalance showed itself. So with conventional medical thinking, you may have to remove the uterus, but we know with holistic thinking that the problems are just beginning, because this problem has just lost its way of showing itself. But the problem goes on, and that's why these operations are usually not the end of the story. And again, I would emphasize, sometimes operations are necessary, and I do not want to give the impression that these are always wrong, but a lot of operations are unnecessary. A lot of medical treatment is unnecessary if people would understand the connections. In defense of doctors, we would also have to say, however, that many people get the kind of medical treatment they want. I know doctors who are really consciously trying to use holistic principles in their practice, trying to motivate patients to change their lifestyles, to eat better, and they find that the mentality of many people is a pill and treatment mentality. They don't want to be involved in their own health creation. They want to be treated. And so the kind of things we're talking about here is really for a minority of people. But the people I feel sorry for are those who don't understand these connections. But if they only had access to this information, they would change their life. They would change the way they eat every day. They would change the way they spend their free time so that they would live more in harmony with their biological needs and remove the need for medical attention. So when we think about these things, we want to keep that in mind, that although I do point out oftentimes critical aspects of medicine, we have a need for this kind of medicine because the majority of people, in any case, are not willing to make those changes, and we have to try to help them somehow. So, now we'll continue here with the face. Sometimes it'll be things like pimples, which will develop in the area, but always getting pimples only here. Never get pimples here, always just here. Some women will get the pimples here in connection with their period. This is a real clear connection, that the menstrual cycle is in order. Now again, here I'd like to point out one thing. We're talking about the sexual organs. That is that there is a lot you can see by looking. But as I said in my introductory comments earlier, in an earlier session, the best way we can use this is also in asking questions. If I were actually doing a counseling session with a woman who was involved with some kind of problem in the sexual organ area, I would want to hear from her, how is your menstrual cycle? Because a menstrual cycle should not be painful. You know, it should have a certain clarity to it. And if there's a lot of pain and cramps involved in this, then you've got a problem, which definitely is connected to food. And as I said also in an earlier session, sometimes you will see people who have no sign at all here, but they have these problems in spite of it, because there are different ways that these problems can show themselves. So we want to be careful not to think that only people that have these signs will have problems in that area. Some people show nothing at all, but when you hear them talk about their health problems, you know what's going on. And of course, one of the biggest problems has been the use of the pill for many years, which was considered a great leap forward for mankind, and which turned out to be a real dud as far as our health goes, because I have found that women who have taken the pill tend to have more problems in this area, and interestingly enough, a lot of blood sugar problems. They get more pancreatic difficulties. But that's another subject. We'll take that up later. So, these two areas now, the mouth and the area around the mouth, are showing us this lower area of the body, the intestines and the sexual organs. The people who have the best results with this therapy are those that think about all kinds of ways to help that. If a woman has got a lot of discoloration here, and she's thinking, okay, this is, even though I'm basically satisfied with my period, I know there's something I should do because this is not good, this is a clear sign, then it would be partly the food, of being careful with the animal quality and the salt that we talked about, but also being careful not to wear very tight pants. You know, because the whole area can get very blocked by tight pants. And this goes with the styles. There's at certain times when the pants look like they're sprayed on, and there's other times when they look like they're comfortable. But when a woman does decide to wear pants, she should always remember that it shouldn't be too tight, because this will tend to block blood circulation in the area, and if there are problems, then that's a good thing to take into consideration. So in other words, there's lots of aspects here besides the food. But in any case, this area will show us very clearly about that. Now, if a woman is having difficulties in her menstruation, she should consider perhaps doing something we call hip baths. which you can read about in different books, because it's also a great help for restoring balance, because what you need is a discharge. These kind of things are showing excesses that's gathering here. Ovarian and uterine problems are excesses. It becomes cysts, it becomes tumors, and it's excess being gathered. So like basically the body is an optimist. The body is always thinking, well, we've got this excess, what shall we do with it? You know, and think, well, why don't we store it, because maybe there'll be some hard times. And then when we've got hard times, then we've got this excess that we can fall back on. You know, so let's make some positive use of all this excess. But the hard times just don't come. And it's just more and more excess. So in the end, you have an area which is now has a decreased blood flow. When you get cysts and tumors building, it decreases the blood flow. The oxygen is less, and you get an area that very easily can turn into something which doesn't have your benefit in mind. In other words, malignancy. So if we understood these things, like if women understood that having cysts are actually a precancerous sign, they would take them more seriously than to just say, well, my doctor says it's benign, there's nothing to worry about. We should all be concerned with any kind of cysts or tumors building in the body, whether they are benign or malignant, because they're signs that we don't have our body in balance, that we've come out of balance, and by using diagnosis, we can see this imbalance coming much faster than we could otherwise. Now, I'll be going in other sessions to some other ways of seeing this imbalance in both these things, both the intestines and the reproductive organs. But for this session, we've been able to deal with these, and I would like to, in the next session, go right on to other parts of the face so that you will get a complete picture of how we use the face for diagnosis. So with that, we will conclude this session and we'll take a break.